Hi, I'm Dr. Singhania from Singhania Clinic, and I'm here to talk to you about treatment of eczema. Eczema treatment is divided into two main parts. One is prevention and the other is actual treatment during flare-ups. Once there is family history of allergy, pregnant women should be very careful, and taking probiotics in the last trimester is very helpful. The best form of delivery is vaginal natural delivery, because as the baby passes through the canal, they swallow the bacteria from the mother's womb, vagina, and this causes the establishment of normal bacterial microbiome in the gut, which is extremely helpful to prevent allergies. Breastfeeding is the best form of feeding a baby and preventing allergies. Not only does breastfeeding help to prevent allergies, but all other formula milks are cow milk, and cow milk is a very allergenic substance and can give rise to allergies in the baby. Giving probiotic drops, avoiding allergenic foods like cow milk, like egg, fish, peanuts. These are very common causes of eczema and should be avoided. Exposing the baby to the natural environment means don't be too hygienic. Washing and keeping the baby away from non-pathogenic bacteria which don't actually cause problems, is actually harmful to the baby. So a natural environment is preferred, but of course we avoid scented soaps, oils, and smoking is completely prohibited in a child's house. And children who are a little older, the first most important is to test for the allergens and of course avoid them, because as the old adage goes, prevention is better than cure. So find out what your child is allergic to. What is the cause of eczema? As I said, 30 to 50% of children with eczema are allergic to food, particularly cow milk, wheat, egg, fish, peanuts. So find out what he's allergic to. A dust-free room is preferable, and when I say dust, it's actually dust mite and not normal dust, because a lot of parents will tell me, oh, but our room is very clean. It's not the cleanliness, but it's the protection against dust mite. As I said earlier, avoid allergenic foods, smoking. Irritants can cause itching and inflammation, so it's better to use pH neutral soaps like Dove, or preferably no soap at all, especially in the moderate and severe forms of eczemas. All new clothes should be laundered because to remove any chemicals that may be on the material. Open weave loose fitting clothes like cotton is preferable, and wool should be avoided. The humidifiers help to prevent excessive skin dryness, and an AC in the summer prevents sweating, so that's very useful. The first step of treatment during a flare-up, so when the child has active eczema, the main thing is lukewarm soaking bath, because the first important thing is rehydration. When the skin is rehydrated, it becomes softer, it is less likely to be hurt by irritants, and it's more likely to be affected by emollients and other medical treatments. So in a warm bath for about 10 to 20 minutes, if you soak the child in with olive oil or virgin coconut oil, and then as soon as the child is removed, the child should be dried immediately, because drying of water or evaporation of water can cause drying of the skin. As I said earlier, use no soaps, or if possible use hydrophobic lotions and creams. There are very many cleansing creams available, and these can be used without water, and they leave a very fine film of glycol, which then protects the skin as well from further irritation. Emollients are one of the bases of treatment for eczema. Vegetable oils, Vaseline, these are all preferable. There are certain creams which contain ceramides and lanolin like Triceram, which help to repair the skin. Urea containing products soften and moisturize the skin. And sometimes if the eczema is very severe and lichenified or thickened, then wet dressing over those patches can cool and reduce the inflammation. Finally, we come to medications. Steroids are very effective and they can immediately reduce the eczema, but they have very severe long-term side effects, so they should be sparingly used. Only the low potency creams should be used, and that is mainly should be for face, axilla and groin, and sometimes, rarely, oral steroids are also needed because eczema can be very severe. Other creams like the topical calcineurin inhibitors can be used intermittently. Antihistamines are very good to prevent itching because once the child starts to scratch, inflames and the eczema worsens. Doxepin cream is very good for very severe itching, and if there is any infection, then antibiotics and antimicrobial creams are essential. If you're seeking help, please visit us on our website www.singhaniaclinic.com or call us on the number or email shown. Thank you.